Now, tell me something. This patient that was on meds and talk therapy, did you put him on this new program?
Yes, well, and how that came about for going back in time, he would tell me sometimes, is there anything new? Is there anything new? Because the meds just weren't doing it for him, and he had such side effect cognitively, mood-wise. His wife, his mother were so concerned about the effects that the medication was having on him. And so one fine day I was able to give him a call and say, you know what, John, come on in. Because guess what? I have the something else. I have the something else.
Right, right.
And it was actually a heartfelt and even a couple of tears in our eyes, because we had finally gotten to the point where technology brought us something.
Now, how long does he stay in, when you do the treatment, how long do they, with the TMS, they sit in this chair?
Yes.
Can you explain it a little bit? Tell us a little bit about
as
what
I said, it looks a bit like a dental chair or maybe a spa chair. It goes in the recline position. And you're free to converse during that time. We have TV if they want to watch TV. They can listen to music.
And it doesn't feel like anything, really. Does it feel like...
Very relaxed. Some people even kind of go into a meditative
state.
Some fall asleep. Most like to chat. I'll be in and out of the room. There's an operator. They're never alone in the room. The only thing you do have, the magnetic piece that is leaning on it, so non-invasive leaning. And what you have is 4 seconds of pulse. Not hurting in any way, and not any kind of sound that
would offend you.
Is not offensive in any way. You have at 2 seconds a chime that lets you know your 4 seconds of pulse are coming. The 4 seconds of pulse are your treatment, and you have 26 seconds at rest. And what everyone is amazed that the 37 minutes of treatment go by so quickly. You don't even realize.
Now, how do you feel? Euphoric afterwards?
I'm sorry?
Do you feel euphoric or any different after the treatment?
They can drive, they can go to work, they can do absolutely anything in the normal course of their day.
And after how many sessions do you see the change?
Well, our research is indicating that 5th or 6th week is when we'll see change. But I'm seeing something much, much earlier. Really? In Debbie's case, by the 5th to 7th day is where we saw that radiant smile and bright eyes.
Now, she's not on she doesn't have to take any medication anymore?
No.
Wow. No. That's unbelievable. Absolutely.
Yeah.
Now, does insurance cover this?
This is a fabulous point that you're bringing up. We got the CPT codes.
Okay.
And to anyone who doesn't know, because that's in the insurance world, CPT codes are the codes that indicate this is a standard of care. So any doctor's appointment that you go to, any treatment or procedure has this code that is assigned to it. So now TMS treatment has had its formal and official approval, let's say, because now it has the CPT codes in effect. So it is recognized as a standard of care, and it has its codes that would allow for reimbursement. Oh,
that's great. So they pay for it and then reimbursed or not?
Well, what we're facing right now, and again, we're all the pioneers right now, and I'm proud to say that I'm one of those. We're a force of 300 strong right now.
Oh, there's 300 practitioners?
Throughout the country.
Okay.
Throughout the country. And now what we as the pioneers are doing, we're awakening the system so that they know that it's there. Even though those numbers are there, they have to know. So we're actually going through a process of getting that awakened in that insurance world.
That's good. So it is being reimbursed.
It will be.
It will be.
It will be.
It will be.
Prior to having those CPT codes, they were being given tracking numbers and being discussed on a case-by-case basis. And even in that situation, there was 75% reimbursement.
Do you see a day when there's not going to be a medication ever?
I don't know if I can say ever. I don't know if anyone can make that kind of prediction, but let us just say that obviously as science and technology advance in mental health and in all branches of medicine, science and technology are moving forward by leaps and bounds, and we will be less dependent
on drugs.
On drugs.
So what's that going to do for the pharmaceutical industry? Change it?
Change it.
Change
but life has changed.
Changing all the time. And you want to give your website out again? Because I think that's really important.
Absolutely. www.professionalbehavioralcenter.com and also www.professionaltmscenter.com.